Tired all the time? Weak legs? Achy back? Low mood? It might not be just life. These are 8 silent signs of vitamin D deficiency many adults miss. And number 5 doesn't look like a vitamin problem at all. Vitamin D is often treated like a small thing, just another vitamin. But your body does not see it that way. Vitamin D helps your body absorb calcium, and that matters because calcium is not only for bones. Your body needs the right balance to support muscles, nerves, and normal body function. When vitamin D stays low for too long, the damage is not always loud at first. It can creep in slowly. That is why so many adults, especially seniors, live with the signs without connecting the dots. Older adults, people who spend little time outside, people with darker skin, and people with certain digestive, liver, or kidney conditions can be at higher risk. The first silent sign is constant fatigue, not normal tiredness after a long day. I'm talking about that heavy, stubborn exhaustion that hangs on even when you think you got enough rest. You wake up, but you never quite feel recharged. You push through the afternoon, but everything feels harder than it should. Many people blame poor sleep, stress, or age. And yes, those things matter. But low vitamin D is one possible reason that should not be ignored, especially when the fatigue keeps coming back with no clear answer. The second sign is muscle weakness. This one can sneak up on people. At first, it may feel small. Carrying grocery bags feels more tiring. Getting up from the sofa takes extra effort. Climbing stairs feels like more work than it used to. Some people notice they move slower. Others say they feel less steady. They cannot quite explain it, but their body does not feel as dependable as before. When muscles are not working at their best, everyday life gets harder in ways that seem easy to brush off. The third sign is muscle aches, cramps, or soreness that does not make sense. Maybe your legs cramp at night. Maybe your muscles feel tight even though you did not exercise much. Maybe you keep rubbing your calves, shoulders, or thighs and wondering why they feel sore. The fourth sign is deep bone pain, especially in the lower back, hips, pelvis, or legs. This is not always sharp pain. Sometimes it feels like a dull ache deep inside the body. In adults, severe vitamin D deficiency can lead to osteomalacia, which means the bones become poorly mineralized and weaker than they should be. That can show up as pain that seems vague but keeps returning. Now here is number 5, and this is the one many people never expect. Mood changes. Some people with low vitamin D describe feeling low, flat, unmotivated, or simply not like themselves. They may not feel deeply sad in a dramatic way. Instead, they just feel emotionally drained, less interested, less engaged, less like the person they used to be. That does not mean vitamin D deficiency is the only cause of low mood, and it should never be used to diagnose depression on your own. But it can be part of the picture, especially when it shows up with fatigue, weakness, or aches. The sixth sign is getting sick often, or feeling like your body takes longer to bounce back. Vitamin D plays a role in immune function. So if it feels like every small infection hits you harder, or recovery drags on longer than expected, that is worth noticing. The seventh sign is poor balance or feeling less steady on your feet. Maybe you reach for furniture more often. Maybe you grab the handrail sooner. Maybe your confidence while walking is not what it used to be. For older adults, this matters a lot. Weak muscles plus weaker bones can increase the risk of falls, and a fall can change a person's life in seconds. The eighth sign is fragile bones, repeated injuries, or a fracture after a minor fall. This is one of the clearest reasons not to ignore the earlier signs. When vitamin D is too low for too long, your body may struggle to maintain healthy bones. In simple words, vitamin D helps your body use calcium properly. Without enough vitamin D, calcium absorption drops. Then the body may try to keep calcium levels normal by pulling calcium out of the bones. Over time, bones can weaken and muscles can suffer too. That is why a deficiency can show up in so many different ways before a person ever gets tested. So, what should you do if several of these signs sound familiar? First, do not panic, and do not start taking large amounts of vitamin D on your own. More is not always better. Too much vitamin D can also be harmful. The safer step is to speak with a healthcare professional, especially if you are older, mostly indoors, have darker skin, or have a condition that affects nutrient absorption. A blood test can help show whether vitamin D is actually low. That matters because these symptoms can have many causes, and guessing is not the same as knowing. There are also simple, realistic steps that can help. Safe sunlight exposure can help many people depending on where they live, the season, and their skin. Some foods contain vitamin D, including oily fish, egg yolks, and fortified foods. In some places, health guidance also recommends routine vitamin D supplements during months with limited sunlight, but the right amount depends on the person. If you are considering supplements, it is smart to ask your doctor or pharmacist what is appropriate for you, especially if you have other health conditions or take regular medicines. And please do not wait if you have worsening weakness, severe bone pain, frequent falls, trouble walking, or a possible fracture. Those are signs to get medical help sooner. Your body often whispers before it screams. Fatigue, weakness, aches, mood changes, poor balance. These signs may look ordinary on the surface, but sometimes they are your body asking for help in the quietest way possible. Listen early. Act early. And remember, this video is here to inform you, not replace professional medical care. If you found this helpful, like, subscribe, and share it with someone who may be ignoring these silent signs too.